If and when a vaccine becomes available, getting people to take it might present a bit of a challenge. According to a new CNN poll, just 56% of Americans now say they would get vaccinated against the virus. That's down 10% from May. The dip is concentrated among supporters of Donald Trump. Half of the president's supporters said they would seek a vaccine in May, and only 38% say the same thing now. Convincing people to take a vaccine will be one challenge. Wide and even distribution will be another. Pope Francis is warning poorer countries must not be left out. Speaking from the Vatican, the Pope said any vaccine must be for everyone.
Sarebbe triste.
It would be sad if the rich are given priority for the COVID-19 vaccine. It would be sad if this vaccine became the property of this or that nation, if it is not universal and for everyone.
Dr. Seth Berkley is CEO of Gavi, the Vaccine Alliance. He's in Geneva for us. Thank you so much for being with us. So how do we make sure that when this vaccine becomes available, that the world's most vulnerable are given equal access to it?
Well, that's a great question. The reason Gavi exists and has been around for 20 years is to try to make powerful new vaccines available in developing countries. We've launched 496 new vaccines over the last 20 years, and coverage levels are highest they've ever been at any time. Of course, in this case, the challenge is going to be, will there be vaccines available for the developing world? And what we're trying to do, therefore, is make sure we can come together to buy vaccines for developed and developing countries to make sure there are adequate doses to go around.
And how do you ensure who gets given first priority?
Well, our belief is you're not safe unless everyone is safe. So although there have been discussions about trying to completely cover a few countries, that doesn't really provide protection in a pandemic when the virus can move around the world and if you have reservoirs of virus that are out there. So the idea would be to distribute it to developed and developing countries at the same time, initially to cover healthcare workers because they're at risk and can transmit, and then to have it available for high-risk groups, trying to get to something like 20% of the population level over the next year and a half. So our goal is to try to have 2 billion doses by the end of 2021, and with that, really tamp down the pandemic globally.
So why 20%? If 20% of a population is vaccinated, does that protect enough of the broader population?
Well, the challenge, of course, is on day one when we have efficacy data, and that, of course, assumes that these vaccines do work. The first day, you're going to have one dose roll off that assembly line. So for the first, say, 18 months, there will be limited numbers of doses. There'll be much more demand than there is supply. So the challenge then is, what do you do with that? And we believe that the right thing to do is to target those at highest risk and those that are most likely to transmit and be most likely to be affected by it. That's how you come to that 20% number. Of course, you don't stop there. You may want to continue to vaccinate going forward. And of course, we need to understand better the epidemiology, given that this is a new agent and we really don't understand fully all the risk patterns around the world and what will happen with population immunity.
A new CNN poll came out showing that only 56% of Americans, if a vaccine was to be available today, would be willing to take it. Does that surprise you that only half of all Americans would actually trust a vaccine enough to actually take it themselves?
Well, I think you're seeing a problem of fear that has bubbled up. And I think this is a real problem. For the first time, we're beginning to see the anti-vaccine community go with nationalists, go with other conspiracy theorists, and the speed at which things are moving make people nervous. Now, of course, I am a great believer in speed, but what we want to cut out is unnecessary bureaucracy and unnecessary sequential nature of the process. We don't want to change at all the safety part of this and making sure that it gets a proper regulatory approval. My own belief is we have to take this seriously, but when we have a vaccine that's been approved by a stringent regulatory authority and we know it's safe and people start taking it and they can go back to a normal existence, then I think you'll see much more demand for it than the polls would say. But right now, people are scared.
So then what should be done just in terms of at least convincing people? You talked about the fear. People are apprehensive about the speed at which things are progressing. Obviously, the anti-vaxxers are out in full force as well. What can health officials do at the CDC to at least counteract that?
Well, the first thing is we have to be clear that we have to follow the science. So we don't want to be speculating about things. We want to follow science, follow the procedures. They're there for a reason. The world has worked quite hard to make sure vaccines are as safe as they can possibly be. And we want to follow those procedures to make sure the products are safe and efficacious. The second thing is what we know is that people trust their healthcare providers, they trust community leaders, and we need to bring those groups into the conversation so that they can work to allay any fears that are out there. And with that, I believe over time we will see a change in that attitude. But of course, we will have to see what the results are on these trials, and that's going to be very important, and to make sure that that information gets out in a proper way with truth behind it.
Right, Dr. Seth, thank you so much for being with us. Appreciate it.
My pleasure. Nice to see you.